After 3 cases of coronavirus being confirmed from Kerala, the state government has now declared it a state disaster. As of now, 2,239 people are under observation in the state. Of these, 84 are hospitalized, whereas 2,155 people are under home quarantine in Kerala.
Kerala today declared the end coronavirus issue as a state calamity because we want to strengthen our surveillance system and all the precautionary measures. Here, the first day itself, when we came to know that end coronavirus is rampant in China, at the same time we formed our RRT and other system here to contain this end coronavirus. We expect that so many children are there in China from Kerala. We expect that they will come back and the coronavirus may affect in Kerala. At the same time, we started our surveillance system, contact tracing, and the isolation, etc. The first day, one result became positive, and after that, yesterday and today, we have 2 more positive results.
My colleague Vivek Karindalam joining us on the phone line. Vivek, we were listening to the health minister telling us the number of measures that are being taken, but is enough being done? 3 confirmed cases in Kerala, over 2,200 people currently under observation. Over to you for the latest, Vivek.
Exactly. 2,235 people are under observation, of which 2,139 are in home quarantine and the rest are in various hospitals. Yesterday, 20 people were admitted in various hospitals. And since the number has surged in large numbers, with the number of people who are coming from China, the chief minister yesterday decided to call coronavirus, that is novel coronavirus, as a state disaster. Now, this is something which rarely happens, calling a disease as a state disaster. Very rarely it has happened. Earlier, some 15 years back, there was an instance like this. Now, this is mainly because 3 people has been tested positive, one in Kozhikode, one in Alappuzha, one in Thrissur, and one in Kasaragod. Now, what we understand is that the health status of all the 3 are stable. They are responding to medicines, and also they are, they don't show any high-end, kind of issues which usually a coronavirus affected patients show in their later stages. So what we understand is that they are in their initial stages and that they will recover because they are having conversations with the hospital officials. They are walking inside the ward. So there is nothing to worry as such. But still, the government has declared a state disaster mainly to make sure that precautions have been taken here, because remember, this is for the first time that such a virus is being dealt with by the health department. Remember earlier when H1N1 and Nipah virus had broken out, that Kerala has successfully managed to contain them, to prevent them from happening, even though there was death that was reported in case of Nipah. But in this particular case, remember, there is no medicine that has been invented as far as coronavirus is concerned. And that is the reason why the government want to make sure that there is no casualty that will be reported. There is control rooms in every district. At the health headquarters here in Trivandrum, there is a control room, and all headquarters also there is control room. So all those people who are coming from China should report to these places. And any early suspicions regarding suspicion, especially if any cough or sneezing or any high fever has been reported, that you are supposed to report to these places, because there was instances where such people who have come from other countries, did not report, and they have gone to malls and other places where people gather. So the government does not want such instances to happen, and that's why the government very upright about that.
Absolutely. In that sense, Vivek, the health authorities have a huge responsibility. Everything depends on how they control this and how they contain this, because this is one of those outbreaks that happens. Transmission happens human to human. It's an airborne disease. Huge responsibility for all the health authorities to contain this in Kerala after 3 confirmed cases of coronavirus. Thanks for joining us, Vivek. Well, 406 people who were evacuated to Delhi from China from the Wuhan city have all tested negative. Periodic medical checks are being done and all tests are also being done on the patients. 4 isolation beds have been kept prepared at the facility and doctors from AIIMS and Safdarjung are currently visiting to assist the medical teams. So while Kerala has declared coronavirus a state disaster, let's also look at what the other states are doing in this regard. In fact, we're going to take you through some latest developments from the other states. My colleague Avni will join us, in fact, to give us an understanding of how the other states are tackling the situation. Avni, good morning. Can you take us through the latest information around this, please? The way the other states are putting measures in place to contain or rather to prevent any outbreak of coronavirus?
Well, yes, there are a lot of measures that are in place across India at the moment, various states doing a lot to ensure that this doesn't sort of spiral out of control, including screening measures at various airports. But as far as the latest developments are concerned, let's first take you through what is happening in the national capital, in Delhi, at this point in time. So there were 13 suspected cases in the last 1 week in Delhi, and 8 of them turned out to be negative, but results of 5 are still awaited at this point in time, so that is going to be key to watch out for. There are 406 evacuees from Wuhan who have been brought back from Wuhan who have tested negative. So that's good news, at least on that front. Doctors from both AIIMS and Safdarjung Hospital are monitoring the evacuees at this point in time. So that's as far as the national capital is concerned. Meanwhile, there has also been a scare as far as West Bengal is concerned, and we'll just pull up that for you as well. Now, the health department in West Bengal has traced 8 people who were on the same flight with the infected Kerala patient. So remember, there have been 3 cases confirmed in Kerala, and one of them that was the case there. 8 co-passengers landed in Kolkata on Jan 23rd, which include 3 Chinese and 5 Indians. The health department is in touch with the suspected cases at this point in time and is monitoring the situation very carefully. So that's as far as West Bengal is concerned. So this is, of course, the situation on ground right now. Everything is being very closely monitored to ensure that it's controlled and doesn't spiral out of control. Afrida.
Absolutely. Thanks very much, Avni, for giving us the overall picture and measures taken by other states. Thanks.